the focus of today, Pandemic Resilient Cities, in collaboration with Emergency Architecture and Human Rights and a think tank based in London called Think Fast, collective urban response to COVID-19.
My name is Emmanuel, and I'm the director of the Copenhagen Center for Disaster Research and an associate professor at the School of Global Health at the University of Copenhagen. We gathered here today to talk about pandemic resilient cities. What I will talk about today is primarily the fact that we shouldn't be forgetting the ultra-vulnerable populations in many cities across the world. As we see the COVID-19 pandemic ravage many of the cities across the world, we see that some of the worst affected are the marginalized populations of society. This is not new information. We've seen this with many disasters in the past. However, there's very little action on making sure there's social protection in normal times so that people can use these social protection mechanisms when a disaster or a pandemic occurs. It's time to realize that we need to change the way we work with disasters and pandemics, that we continue to respond. We need to stop making or creating disaster risk and build more resilient cities.
My name is Luca Fontana. I'm a toxicologist, epidemiologist. I've been working for the last 7 years with Doctors Without Borders and currently with the World Health Organization as technical reference for highly infectious pathogen. The same mistake I saw in the field with Doctors Without Borders for the last year in terms of outbreak response, it's what I'm seeing here as well right now, where we have containment facility. When we don't talk with the community, we try to isolate person to avoid the disease to spread without trying to get the community engagement on that. And this is the kind of mistake we were doing before, it's the mistake we're doing now, and it's something we should really learn how to improve.
I think what we can learn from the past, but also understanding what we can go and deal with the future, is if we take the case, for example, of Venice, or Philadelphia, of London that we show it today. I think what we can bring is basically the need of a connection between the building environments sector and the health sector.